Hello, welcome to ANE community. From the past several videos, we are discussing about the concept of Samprapti, or what we can say, the pathogenesis or the process of pathological events mentioned in Ayurveda. In this particular videos, we have discussed the three determinants of Samprapti, that is Dushta dosha, Anuvisarpana of the dosha, and Amayasya Nirvritti. After that, we have started discussing with the types of Samprapti. Initially, we have discussed Vikalpa Samprapti. Afterwards, we have discussed Pradhanya Samprapti. Later, we have discussed Balakala Samprapti. Along with Balakala Samprapti, we have discussed Bala Samprapti and Kala Samprapti. In this particular video, we are going to discuss about the concept of Vidhi Samprapti, as mentioned by Charaka Samhita. When we speak the term Vidhi Samprapti, it is specifically mentioned in Charaka Samhita. It is not mentioned in Ashtanga Hridaya as well as Madhavakara. So, Madhavakara and Ashtanga Hridaya has separately included this Vidhi Samprapti in Samkhya Samprapti only. Whereas the Balakala Samprapti of Charaka Samhita were being subcategorized into Bala Samprapti and Kala Samprapti. When you think about the term Vidhi Samprapti, Vidhir Nama, Dvidha Vyadhayo, Nijagantu Bhedena, Trividha Tridosha Bhedena, Chaturvidaha Sadhya, Mrududaruna Bhedena. When you think about Vidhi, so these are the classification of the diseases based on certain parameters. Whenever we are classifying the diseases based on certain parameters, that will be having the one particular goal in the mind or one particular purpose in the mind. So, for example, when you think about the Nijagantu Bhedena, that means the term Nija refers to the vitiation of the dosha taking place in the body, whereas Agantu Bheda refers to the causative factor, which are considered to be the external ones. So that means when you think about the symptomatology, in case of the Nija Vikara, first there will be dosha vitiation, later there will be symptom manifestation. Whereas in case of the Agantuja Vikara, first there will be symptom manifestation, later after a matter of 7 days, there will be dosha vitiation takes place. So that means both are considered to be the pathogenesis will be different. Hence, so the line of treatment should be different in those two situations. When you think about the Trividha Tridosha Bhedena, the three types of the disease are based on the dominance of the dosha. So that means either it may be Vataja dominance or Pittaja or Kaphaja. Each types of the dosha dominant diseases are having specific line of treatment. For example, when the person is suffering from Vata dominant disease, that may be due to Ruksha Guna Vriddhi or Lagu Guna Vriddhi or Shita Guna Vriddhi or Khara Guna Vriddhi, etc. So that means whenever if you are giving the line of treatment, Ruksha Guna Vriddhi Janya Vikara should be compensated with Snigdha Guna substitution. Lagu Guna Vriddhi, dominant Vataja Vikaras should be treated with Guru Guna Vriddhi or Guru Guna substances as such. So like that, the Tridosha dominant diseases are classified in that particular manner. Whereas the four types of the diseases based on the Sadhyasadhya Mrududarana Bhedena. When you think about this Mrudu Dharuna Bhedena, Sadhya in the sense, when the person is having Mrudu Sadhya, in the sense that is considered to be Sukha Sadhya Vikara. Here, the term Mrudu refers to Alpa Bala Roga. So that means it is Sukha Sadhya in nature. So that means the person will be having Roga Bala less and Rogi Bala more. Whereas the Daruna Sadhya, in the sense where the Roga Bala will be somewhat more when you compare the Mrudu Sadhya Vikara. So that is a little bit difficult to cure in that particular situation. Whereas Mrudu Asadhya, in the sense where the Roga Bala will be more than the Daruna Sadhya Vikaras, and Rogi Bala will be comparatively less. That is Yapya Vikaras as such. Whereas Daruna Asadhya Vikara, in the sense where the Rogi Bala will be comparatively less, whereas Roga Bala will be much more when you compare the Mrudu Asadhya Vikara or Yapya Vikara. When you think about the Charaka Samhita Sutrasthana 10th chapter, they have described the lakshanas of Sukhasadhya Vikara, Krishnasadhya Vikara, Yapya Vikara, and Pratyakshaya Vikara. So we have to look into that those lakshanas in that particular chapter itself. So this is what we can say the Vidhi Samprapti as such. So that means the classification of the diseases are made with a purpose kept in mind. So regarding the application as such, when you think about Vidhi Samprapti in Jwara, so that is the depending upon the adhisthana or site of the disease. As far as the Ayurveda is concerned, Sharirika as well as Manasika Vikara. That means as far as the adhisthana. So that means Sharirika Jwara and Manasika Jwara. So that means the person is suffering from the involvement of either Vataja, Pittaja or Kafaja Vikara, Kafaja dominance as such, that is usually associated with Sharirika Vikara as such or Sharirika Jwara. In case of the Manasika Jwara, the person may be having the Rajo dominance or Tamo dominance. Both are requiring specific line of treatment there. When you think about the effect happening inside the body, Saumya and Agneya Vikaras are being mentioned. When the person is suffering from either Vataja Jwara or Kafaja Jwara, they will be having the Saumya effect in the body. Whereas the person who is suffering from the Pittaja dominant Lakshana in Jwara, that will be associated with Agneya type of Jwara as such. Both are requiring specific line of treatment as such. As far as the Lakshana are concerned, in terms of the Dhatu involvement as such, Antarvega Jwara and Bahirvega Jwara are being mentioned. So, Antarvega Jwara, they are considered to be Krichasadhya in nature, whereas Bahirvega Jwara, that is considered to be Sukhasadhya in nature, because Bahirvega Jwara, we can able to perceive the Lakshanas, whereas Antarvega Jwara, it is a little difficult to perceive the Antarvega Jwara as such. As far as the time of aggravation of the Lakshana, Prakrita and Vaikrita Jwara are being explained. When you think about the Vataja Jwara occurring in Varsha Rutu, that is considered to be Prakrita Vataja Jwara. If the person is suffering from Vataja Jwara, other than the Varsha Rutu, in any of the seasons, if the person is developing the Vataja Jwara, then it is considered to be Vaikrita Jwara. Similarly, Sharad Rutu Janya Pittaja Jwara is considered to be Prakrita, whereas the Pittaja Jwara manifested in the Rutus other than Sharad Rutu, that is considered to be Vaikrita Jwara. Person is suffering from the Kafaja Jwara in Vasanta Rutu, that is termed as Prakrita Kafaja Jwara, whereas the Jwara manifested in the Rutu other than Vasanta, that is considered to be Vaikrita Jwara. So this is the significance of the predicting the prognosis or Sadhyasadhyata as such. As far as the strength of the patient as well as the disease, Sadhya and Asadhya Jwara are being explained. Sadhya in the sense, if the person is having the exposure of the Nidana, that is milder form of Nidana, or milder form of the Lakshana are being manifested, then such kind of the Jwara is considered to be Sadhya Jwara. Whereas Asadhya Jwara, where the person will be having the exposure of the Nidana, will be having the little bit more and more virulence, and the person will be having the Lakshana, that is having the more and more severity, and the person will be having the multiple dhatu involvement, etc. In that particular situation, the person may be having the asadhya lakshana. Depending upon the duration of the jvara, 5 types are being explained: santata, satata, anyadishka, tritiyaka, and chaturthaka. Depending upon the dhatu involvement, 7 types are being explained: rasadhatugata jvara, raktadhatugata jvara, mamsadhatugata jvara, medo dhatugata jvara, asti dhatugata jvara, majja dhatugata jvara, and shukra dhatugata jvara. Whereas depending upon the presence of ama, 3 types are being mentioned: amajvara, pachamana and niramajvara. Depending upon the dosha dominance, 8 types are being explained: vatajajvara, pittajajvara, kapajajvara, dvandvaja, that is vata pittaja, pitta kapaja, and vata kapajajvara, and sannipataja, where all the 3 dosha are being explained as far as the vitiation of the dosha are concerned. Lastly, agantujajvara. So these are the 8 different types depending upon the Sankhya Samprapti as such. So when you think about each and every such type of classification, each are having the mentioning with the specific purposes as far as Sadhyasadhyata are concerned, as far as the Vyadhi Vinishchaya is concerned, as far as the Chikitsa of the disease are concerned. As far as the further application of Vidhi Samprapti, when you think about the Vata Vyadhi, they are considered to be 2 types: Santarpanajanya as well as Apatarpanajanya. So that means when the person is developing the Vata Vyadhi, if it is happening because of the Divaswapna, that means sleeping during daytime, or if it is happening because of the presence of ama in the body, that is the kapha dominant nidana sevana is observed in the patients, then we are going to say the Vata Vyadhi happening due to Santarpana effect in the body. That requires the Apatarpana line of treatment there. Whereas Apatarpana Janya, that means all the Nidanas are being mentioned in Vata Vyadhi other than Divaswapna and Ama are said to be Apatarpana Janya. So that means, that requires Santarpana line of treatment in those situations. Further, Vata Vyadhi based on the pathogenesis, Avarana Janya and Dhatukshaya Janya. So that means when the person is having the Santarpana type of effect, that is considered to be probably due to Avarana Janya. Whereas the Vata Vyadhi manifested due to Apatarpana effect, that is considered to be happening due to Dhatukshaya effect happening in the body. So those require specific line of treatment. Whereas the next aspect, as far as the Vata Rakta is concerned, Uttana and Gambhira Vata Rakta. That means Uttana in the sense where the dosha will be observed, or vitiated dosha will be observed in between Tvak and Mamsa. Whereas Gambhira Vata Rakta, where the situated or the vitiated dosha will be situated in the deeper dhatu as such. That means Medas, Asti, Majja and Shukra. So that means whenever if you see about these aspects, then we are going to say the Gambhira Vata Rakta as such. This is specifically helpful in determining the actual Sadhyasadhyata as well as Chikitsa as such. Whereas if you look into the Rakta Pitta, Urdhvaga, Adhoga and Tiryagata Rakta Pitta, this is helpful in predicting the Sadhyasadhyata. If the person is suffering from Urdhvaga Rakta Pitta, that is considered to be Sadhya in nature. If the person is suffering from Adhoga Rakta Pitta, then it is considered to be Yapya in nature. If the person is suffering from the Tiryagata Rakta Pitta, so that means the bleeding is observed in the other areas, for example skin, etc., then we are going to say it is Tiryagata Rakta Pitta, it is Asadhya in nature. As far as Urdhvaga and Adhoga are being explained in terms of Amla Pitta, depending upon the presentation or the clinical presentation or the Lakshana manifestation, we are going to say the 2 types are there. Both are requiring specific line of treatment as such. When you think about the cerebrovascular accident, which is being considered to be Pakshakata as such, wherein the uh, pathogenesis is considered to be due to either ischemic or hemorrhagic as such. Both are requiring specific line of treatment. So the take-home message from today's discussion, that is, the Vidhi Samprapti is specifically mentioned by Charaka, whereas the Vidhi Samprapti is being included in Sankhya Samprapti as per Vagbhata as well as Madhavakara. Vidhi Samprapti actually refers to the types of the diseases based on several parameters. For example, regarding the dosha dominance, or otherwise regarding the type of the Nidana Sevana, or regarding the type of the Dhatu involvement, etc. So the main idea of stating this type of Samprapti is to determine the Sadhyasadhyata as well as to plan the appropriate line of treatment. Dear ANA community, what are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you would like to hear in the coming days? Mention in the comment box below. And spread this particular video to maximum number of true Ayurveda learners or true Nidana learners, so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.